I'm presenting a case of Mrs. X, wife of Mr. Y, who's a 21-year-old female resident of Pandesara, Surat. She is Hindu by religion, illiterate, homemaker by occupation. She is a primary gravida with 9 running month period of conception, and she presented to us for the first time in the labor room with complaints of weakness and easy fatigability since 15 days. She also complains of swelling over her lower limbs since the past 7 days.
What are the other differential diagnoses you will keep in mind by history and examination? You have just straight away said, as Dr. Sunita has also asked earlier, that it's a case of severe anemia. So what are the points which are telling you that it is severe anemia? And what are the points which are saying that it is not a cardiac disease or any other disease you are thinking of?
Yes, ma'am. The patient did not give any history of breathlessness. There's no breathlessness either on rest nor on exertion. There's no orthopnea. There is no paroxysmal nocturnal dyspnea. And there's no family history of any congenital heart disease. Since childhood, she has never had any syncopal attacks.
38 weeks, she goes into labor. She comes, she's 3 centimeters dilated. What do you want to do? How will you monitor this patient in the labor room?
And she has severe anemia. She is 6 grams, or she has corrected her.
You corrected her. She's now around 8, I said 9 to 10 grams anemia.
Okay. So the intrapartum, she's 3 centimeter dilated. I will allow her to go in spontaneous labor. I will plot her progression in the labor, check for fetal distress, and check if the patient does not go into prolonged labor. Because anemia itself increases the risk of operative delivery.
There's a cytokine that you mentioned earlier, that was hepcidin.
Yes,
so
sir.
hepcidin works on something called as ferroportin. So that ferroportin is also present in the syncytial trophoblasts and the placenta.
Yes,
so
sir.
when hepcidin decreases in pregnancy physiologically, the ferroportin becomes much more active and it pulls a lot of iron from the mother to salvage the fetus, which is why fetal anemia is very unlikely. There might be fetal growth restriction because of chronic anemia, but to have fetal anemia, you would want to rather look at other causes of hemolytic fetal anemia, or the reason there is some hemolysis that is going on in the fetus. So
yes, I totally agree with Dr. Aditya. I don't think iron deficiency anemia in mother, and that too, if you're correcting it, it does not reflect in the fetus.
In fact, in postpartum period, you have to divide first 24 hours and next 24 hours. In first 24 hours also, first 6 hours, which is very important because all the blood is now rushing back to the heart. She may go into failure. So you have to look for the vital monitoring is very important for first 6 hours of delivery and the urine output. And after that, yes, if her vitals are all right after 24 hours, her hematocrit is maybe 7, maybe 6, we will not give blood transfusion now. Blood transfusion is indicated when it is affecting her pulse rate, her blood pressure. Now we have time to build her up. So then we give IV, like Madam said, Dr. Pratima, IV carboxymaltose can be given in those cases. That's very important.
And the National Intensified Iron Program has Anemia Mukt Bharat program, which was launched in 2013. It has 6x6x6 strategy. There are 6 interventions, there are 6 beneficiaries, and there are 6 institutional managements that should be done to ensure that this is happening. The 6 beneficiaries which come under the Anemia Mukt Bharat program is children which are 6 months to 59 months of age, then 5 to 10 years of age, then adolescents, both the girls and the boys, which are 11 to 19 years of age, the reproductive age women, the lactating and the pregnant women. These are the 6 categories which are there in the Anemia Mukt Bharat program.
Dr. Pratima, ma'am, how would you score on the exam?
Pass with distinction.
Yeah, she could answer 75% of questions. Yeah.
Yeah, it was like a rapid fire round, and Jyotika was like one after the other. She was answering. You answered well. Keep it up.
Thanks. I learned a lot from this session, ma'am. Thank you for taking out time and helping us in our third year.
And we'll have more and more of these sessions. The next session we're thinking, me and Dr. Aditya were thinking probably a gynae case next, and we will let you know. All right. Thank you everybody for attending. Thank you, ma'ams, for giving your precious time. Thank you, Dr. Aarti. Thank you, Dr. Aditya. And most of all, thank you, Jyotika.
Thank you, ma'am.
Thank you, Raya, for inviting us.
Thank you so much, ma'am. Good night, everybody.
Good night.
Thank you, everybody. Thank you, ma'am.